Muscle weakness and pain. Letter of referral. Dear Dr. Mr. Mark Perrin, aged 25 years. I would be grateful if you could see this man who complains of pain in his muscles and weakness on exercise that has been getting worse for the last few months and is now preventing him from playing football. He has no significant past medical history, except for mild asthma for which he occasionally uses a salbutamol inhaler. I cannot find anything abnormal on neurological examination. Is there anything going on? Yours sincerely. Introduction. The list of causes of muscle pain is extensive, but pain or muscle cramps occurring on exercise limits the differential diagnosis. Causes of muscle pain on exercise. Metabolic. 1. Carnitine palmitoyltransferase, CPT, deficiency and other disorders of fatty acid metabolism. 2. McArdle's disease and other disorders of glycogen metabolism. 3. Mitochondrial myopathy. Other. Hypothyroidism. Ischemia. Lumbar canal stenosis. Claudication. NB. Examination may be normal between attacks in cases of McArdle's disease or CPT deficiency, although some cases develop a myopathy following recurrent episodes. History of the presenting problem. In a young, otherwise fit, man, the important differential is between a disorder of lipid or carbohydrate metabolism. Is this a disorder of energy production? How much exercise is possible before the onset of pain? Is a second wind phenomenon experienced? Are there associated painful muscle cramps? Have there been episodes of dark urine, indicating rhabdomyolysis? Is there a family history? Autosomal recessive inheritance is seen in CPT deficiency and McArdle's disease, maternal inheritance in mitochondrial disorders. Is this hypothyroidism? Ask about weight gain, lethargy, cold intolerance, and other symptoms of hypothyroidism. Is this mechanical, lumbar canal stenosis? Find out if the symptoms are confined to the legs, improved by bending over. Lumbar canal stenosis would be unusual in a young man. It is usually caused by progressive hypertrophy of the facet joints and disc degeneration leading to narrowing of the lumbar canal. Lumbar claudication, pain and heaviness of the legs, often proximal, is experienced on standing or walking. Flexion improves the diameter of the canal and therefore the symptoms, hence patients often report no problems with cycling, in which the lumbar spine is often flexed. Is this muscle ischemia? Unlikely in a young man, but in other cases check if the patient is an arteriopath with multiple vascular risk factors. Other relevant history. Was the patient sporty as a child/teenager? If so, this suggests an acquired illness rather than a metabolic myopathy, which is a lifelong condition. Plan for investigation and management. You should explain to the patient that under normal circumstances you would examine him to confirm that there are no abnormalities, as stated in the letter from the GP. If the condition is acute or subacute, the patient may need to be admitted for investigations. If it is a chronic condition, then outpatient investigations followed by review in clinic is appropriate. Blood tests. FBC. Erythrocyte sedimentation rate C-reactive protein, if raised, suggests inflammatory cause. Electrolytes, renal, liver and bone function, routine screen. Thyroid function. Creatine kinase. Other tests. Electromyography may show spontaneous activity or myopathic features. A muscle biopsy is most likely to reveal the specific diagnosis. MRI can show patterns of wasting, which may assist in diagnosis. Lumbar canal stenosis is diagnosed by imaging, MRI, and treated by surgical decompression. Further discussion. It is important to counsel patients with metabolic myopathy about the need to avoid situations likely to precipitate myoglobinuria, which may lead to acute renal failure. Patients with disorders of carbohydrate metabolism should be advised to slow down exercise if they begin to recognize the first onset of symptoms of muscle pain and weakness, and then only resume exercise in small increments. In contrast, patients with disorders of lipid metabolism are prone to more severe attacks of myoglobinuria, which usually develop after prolonged exercise and are worse in a fasting state, and they should be advised to avoid any situation that provokes muscle pain or cramps.